In late 2022, I was diagnosed with ocular melanoma and had the treatment through the eye and ear hospital.
When patients come through, they'll be met by a team of health professionals. So eye cancer nurses to just general eye nurses, orthoptists, medical photographers, and they will take a number of different images of the back of the eye, as well as lots of other preliminary eye examinations, and that's so that the doctors can have a really good picture of each patient's diagnosis, and that will help them come to a definitive treatment.
I didn't do a lot of investigation, I must say. I went down the path of just trusting the doctor. I mean, the choices were really remove the eye or have the therapy, the plaque radiotherapy.
They told me that it had developed and it was pretty much ticking all of the boxes for ocular melanoma, which very much caught me off guard. They spoke about the options for treatment and they spoke about plaque brachytherapy and its clinical success and how that could, I suppose, help overcome the tumour and shrink the tumour.
When patients are diagnosed with an ocular melanoma, they will find that they're given a lot of information. So sometimes it could be a little bit overwhelming. It's important to go through that information slowly and to never be afraid to reach out to your healthcare team if you have any questions at all along your journey. No question is ever a silly question.
It was a very strange experience. You are awake during the operation. You're aware, you can hear everything that's going on, but you're very comfortable. It wasn't something that I look back with great horror.
Interestingly, I didn't realise I had the option to not go under general. I kind of just spoke about it very quickly with the staff and went, oh, general's what I'm going to do. And I think I'd made up my mind before even realising there were other options.
The post-op care, it's very regimented. They come in very regular and they will do their tests, they'll change the dressing, they'll give you, they'll look at the eye and tell you how it's going. And I do remember one of the doctors saying to me that this is a good day. Right now, from this point forward, this cancer is going to be, they're treating the issue. They're treating the tumour. And when you actually start removing the eye patch and you're having a bit of a look at the eye, certainly it's a little traumatic to go through that period. Your eye, this thing that you've looked at every day of your life, your whole life, is, it looks a little battered and bruised.
I would have that liquid build up in my eye and it would sting quite a lot, and that happened for the week and a half, 2 weeks after surgery. And so that was a lot of just waking up, releasing the fluid and then kind of going about my day.
I did have a bleeding from the tumour, which certainly surprised me at the time. I did go to see my doctor within a day or two and he checked everything and everything was still going very well.
One of the symptoms I did experience was light sensitivity, like movie theatres, like going to see plays or going to the footy even, when I'd be like, oh, that light's so bright. But over time, I felt that kind of fell away. And before I knew it, I was back in those spaces, doing the things I love. I think I was expecting it to be a bit of a black and white experience in that I'd undergo surgery and then I'd have these awesome results and the symptoms I had up until surgery would just disappear. So it wasn't until about 6 to 12 months down the track that I really started to feel better.
Every single day that you look at your eye, it's a tiny bit better. And it gets better and it gets better.
I would say make sure you seek out a good support network and that you take the time you need to heal, because it's not a linear journey. Some days you'll feel better and some days you won't feel as good. And that's just all part of the healing process, both mentally and physically. I've
been getting some injections in the eye that basically help to just kind of reduce the inflammation a little bit. I drive, I do everything I did before. There's nothing that has restricted my life from before the op to now. I do have vision issues in my right eye, however, I largely can ignore them. I guess that from a day-to-day point of view, I'm seeing the issue all the time, just a little bit. And that's a nice healthy reminder every day of what's happened, which can be good and can be bad. It must be like every injury. I've got an ankle injury, which is exactly the same.
I think in hindsight, I wish I'd kind of almost briefed my partner or a person I spent a lot of my time with so that they could maybe share some of the load explaining what I was going through.
It's important for patients to acknowledge that it's a really long treatment journey. Recovery can sometimes feel like it takes some time as well. So it's hard to know what to expect until you've actually gone through a diagnosis such as ocular melanoma. So just continue to ask questions throughout the whole process.